We're PLRP Group 20, and today we're here to present our poster, Evaluation of a Risk Stratification Scale for Post-Intensive Care Syndrome in a University-Affiliated Medical Center. Our group is composed of Shannon Wright, Rachel Terry, Angelica Vaqueros, Andre Fernandez, and Lolita Wright-Prolu. Our PLRP mentors were Dr. Shunich and Dr. Melissa Chudau. Post-Intensive Care Syndrome, or PICS, is a compilation of physical, cognitive, and psychological issues that develop during critical illness and persist upon discharge. Previous studies have identified risk factors for post-discharge impairments, which include inadequate pain and sedation management, increased illness severity, incidence of delirium, and increased duration of ventilator support and intensive care length of stay. Currently, there is no existing scale for assessing overall risk of developing PICS. There have also not been any studies that sought to identify a relationship between risk of developing PICS and institutional setting. This study's purpose was to create a scale for classifying ICU patients based on their risk of developing PICS and to compare this risk between teaching and non-teaching services and medical and surgical patients.
This Institutional Review Board IRB-approved retrospective chart review included adult patients admitted to any adult ICU at Tampa General Hospital, TGH, between January 1st through July 31st, 2016. Patients with an ICU LOS less than 24 hours who died prior to hospital discharge were excluded. Each patient's chart was reviewed for the presence of predefined PICS risk factors, which included pain, sedation, and delirium scores, diagnosis of acute respiratory distress syndrome, ARDS, or sepsis, use of extracorporeal membrane oxygenation, ECMO, total days on mechanical ventilation, and overall ICU LOS. Using this data and the criteria identified above, patients were then classified as being at low or high risk for developing PICS, based on the number of risk factors present. Patients with a score between 0 to 5 were classified as low risk, while patients with a score between 6 to 11 were classified as high risk. The primary outcome measure was the percentage of patients classified high risk for PICS. Secondary outcomes were the percentage of patients classified as low or high risk admitted to a teaching service versus a non-teaching service, and percentage of patients classified as low or high risk admitted to a medical service versus surgical service.
Of the 500 charts reviewed, 441 were included in the data analysis. Of these, 3.86% of patients were considered at high risk of developing PICS. The most common risk factor was age greater than or equal to 55 years. The mean risk factor score was 2 and the minimum score of 0 and a maximum of 8. There was no significant difference in the risk factor classification between medical service and surgical service patients, or between teaching service and non-teaching service patients.
One limitation of our study is in regards to our risk factor inventory. Each component was given equal weight. However, previous studies have shown that some factors, such as development of delirium, extended ICU length of stay, and prolonged mechanical ventilation, are more strongly associated with the development of PICS. For future studies, we may also consider adding a moderate category to our risk stratification scale.
Utilizing known risk factors, we concluded that nearly 4% of ICU patients at TGH were at risk for developing PICS during their stay, regardless of admitting or teaching service. As such, we concluded that use of a risk stratification scale may be helpful for identifying patients at higher risk for developing PICS. It may also be useful in guiding the provision of services to minimize these risks while inpatient and upon discharge to mitigate long-term complications of critical illness. Further investigation is necessary to validate the risk stratification scale utilized in this study. This may include conducting a retrospective chart review of inpatient and outpatient follow-up records to compare the patient's risk score while inpatient with actual development of impairments post-discharge.